All right, this is chapter 3, and our topic is obstetrical procedures. We're going to look at obstetrical ultrasound, chorionic villus sampling, amniocentesis, percutaneous umbilical blood sampling, and fetoscopy, as well as cerclage. Let's start with obstetrical ultrasound. This is an image of ancient Sumerian clay tablets from 4,000 years BC. And I can't read it. I'm sure you can't read it. But what this lists is fetal anomalies, even going back 4,000 to 6,000 years. So these have always been with us. And one of the ways that we identify anomalies of fetuses in utero is by use of ultrasound. Now, we've already talked about the first trimester ultrasound, crown rump length, and this is a beautiful picture of that. The crown rump length is used in the first trimester, typically between 8 to 12 weeks. And I want you to notice the accuracy in dating with the first trimester ultrasound is plus or minus 5 days. That is incredibly good. So the best dating with ultrasound is done with the first trimester crown rump length. This one happens to be 11 weeks and 4 days. This is a little bit smaller. This is a fetal pole. Now you can't even tell where is the crown and where is the rump, but this can be very accurate as well. And you can see the X's, which marks the ends of the fetus. Now here we have the yolk sac. This is a normal appearing first trimester ultrasound. Most ultrasounds, however, performed during pregnancy, and if you're going to do one ultrasound, should be done between 18 to 20 weeks. And the reason for this is you have accuracy in dating, not quite as good as first trimester, but about plus or minus 7 days. You also have the ability to do a fetal anomaly survey, an anatomic assessment of the fetus in utero. This is a beautiful picture of a profile of the fetus with the nose and the chin and the mouth. The pregnancy loss rate with ultrasound is 0. There's been probably no imaging study that has been studied as intensely as obstetrical ultrasound. Successive generations of mice and rats have been observed with continuous exposure to ultrasound insonation at the low levels which we use with medical ultrasound. And no consistent findings of abnormalities have been noted. So I think it is relatively safe. You could always ask, have we looked long enough? Maybe in 20 years we'll find something. And for that reason, it is not done routinely in this country. But if you're going to have one done, 18 to 20 weeks. That's going to be the best time to see it. Here you can see a standard view that we use to look at the face with the nostrils, with the mouth, with the palate, the nose, the lips. This is a pretty good ultrasound. You can see the big lips here, and here are the eyes. Now I put those ones in. This is a nice 4-chamber heart. And this can be seen very nicely in the second trimester and third trimester. One of the first trimester screening tests that is used is a nuchal translucency. And you can see here a translucency which is between the neck and the skin. This is done between 10 and 14 weeks. It is performed in association with a biochemical measurement, which is PAP-A, which is pregnancy-associated protein A. And these two together can be used for first trimester screening. It is not routinely done around the country, but you should be at least aware of that. A thickened nuchal translucency is a risk factor for aneuploidy as well as cardiac disease. Here you can see is the nuchal translucency. Now you've got to be sure that you don't measure this, because this is really the amnion. This is the nuchal translucency right here. Here you can see there is a widened nuchal translucency. And this is not a good sign. This one is even wider. You can see from the back of the cranium. Nuchal skin fold translucency. You plot out your findings on this chart, and you can identify what is the risk of fetal trisomy. Three-dimensional ultrasound now is coming much more into use, and you can see a lot of things which you couldn't see before. This is an 8-week ultrasound, 10-week, 12-week, scratching of the face, grasping at the feet, touching of the eyes opening, sucking fingers, smiling. You notice the resolution is not as good as a 2D ultrasound, but the ability to catch the three-dimensional image is aesthetically exciting. This is particularly helpful on the face, and you can see how well you can identify the nose, the lips, and the nostrils. Lots of images are now available showing all the different kinds of facial expressions: in utero, blinking, yawning, grimacing, sticking out the tongue, swallowing. Now these are obviously the best pictures. You don't always get these good pictures. And here's a couple of twins kissing. 4D ultrasound is where you take the three-dimensional and you have it in motion. And that's even more exciting. This is an ultrasound done on the Easter Bunny. And what do you think you can see in the uterus? Ultrasound is highly dependent upon the operator. What do you see when you look at this picture? Unless you know what you're looking for, you're going to miss it. Do you see what I see? Let me help you. And a lot of the time, being able to see the anomalies is dependent upon the experience of the operator. Do you know what you're looking for?